Hey, welcome back, and we're going to talk about patient-centered care with patients. So this is pretty novel, actually, and I think it's so important. So Leslie and Katie, thank you for coming. You've been part of this discussion all morning here, and we're talking about this dual targeting and person-centered care, and both Elaine and I and Rich have all kind of thrown into this mix that we got to take care of this RA stuff. This is serious business, and we want to quiet it down and put it in the background of your life. But the way that we do this is measuring your response with all our metrics, et cetera. And the patient side is different. So as I said in my little chat, rheumatologists are good about getting the chief complaint. I have this arthritis. But the other part is the concerns. So when you started your rheumatology journey, whether it was with your primary care doctor or orthopedist or this, when did you get a chance to express your concerns? And for each of you, what were a couple of the concerns that were not just obvious by saying, my joints hurt? So, Leslie, you want to start?
Sure. I would say, as far as your first question about when I first got that chance to express some of my concerns, probably in my second visit with a different rheumatologist that I get an opportunity to really express a lot of the larger fears that I had, or I guess concerns. Some of the things that I would say I was worried about that may seem less obvious were things like pregnancy in the long term, probably some fatigue-related issues and how that would impact my career moving forward, what I could kind of expect in the long term in terms of progression of the disease. I knew what I was feeling at the moment, but I had a lot of fears about what this would look like 5, 10, 25 years down the road.
We would call those empowerment issues, like how can you take charge to, craft that? And I want to make a point before I ask Katie this, but one of the things about having rheumatoid arthritis is that it's a journey. And I like to make this point to rheumatology practitioners that that's one of the luxuries that we have. This isn't like a 15-minute visit and you're done. This is a lifelong journey. And we often will see patients like you guys who are having a good day of their arthritis-wise, and that gets a chance to open up the conversation, where things aren't rushed and you're having a toxicity, I need to switch this and get a lab test. So we have to take advantage of this marathon thing. So Katie, when did you start echoing your concerns, and when did you have your concerns?
I think a little bit later in my journey. Initially, I think my focus was kind of getting the symptoms or my finger and my feet and what was going on right there, getting that situated. I too have some similar kind of general concerns. We're interested in family planning. I was thinking about the future. And I've had those conversations even more recently with my provider.
It's a long-term journey. Betsy, my nurse practitioner, always says, that there are these golden moments where, everything is kind of cool with the disease. And then, tell me about your sleep, and tell me about your mood. And as we go on in our program today, sometimes those nagging patient-reported outcome questionnaires can be very insightful for us. So those are times that we do this. So I want to thank both of you. I think that your insights on this are spot on. Your experience is what we would expect for a journey of a lifetime. And I'm glad you're both doing so well.
Thank you.